life, and certainly deserves our honor and our respect for having done so. But I also know that the first thing that came to his mind and to his family's mind was not that he was going to have to choose between having care or not having care because of insurance or money or any other issue. His first thought when he heard that he had was not, maybe I should just die and my family. Life was my first thought. So that's something that comes to this weekend. This slideshow, I just like visuals, so I can walk through this. This is a picture of healthcare system collapse. The Smith clan gathered a few years ago before my youngest son was a music teacher, and you might have seen it there, but this one and there's me in the middle. I always tell people I'm the amazing people. You can see skinny, heavy, hair difference. You just have to deal with that. It's me. And there's we have my military son sitting right in the middle, served in the U.S. Army, served in the National Guard that went down in Katrina. He has not been happy with me about appearing in a Michael Moore movie. That's been problematic for him. So we're still working on his education in this process. At the time that our collapse as a family happened, I was working as a newspaper editor of a daily newspaper in South Dakota and Western South Dakota. And one of the things, this was the newsroom, and one of the things that was luckiest for me was Senator Tom Daschle was then the majority leader of the U.S. Senate at the time. And I stood up at a town hall meeting, and a reporter or editor should never do this. You never inject yourself into a question, because that's not being unbiased, and that's not being as professional as you can be. But I was listening to him talk about health care and all the ideas. Stood up and I said, Senator Daschle, stop having brain death, please. I want what you have, at the price that you pay for it. And he kind of winced a little bit. But I thought, why in the world should we as Americans pay the taxes to give our senators and our congress? Our senators have benefits for life if they choose to have them through the federal benefits plan that we pay for. And they get a cost that we can only imagine out in the open market for health care. Now, that's not what I advocate we should all have, but at that time, several years ago, that would have been better than what we were struggling with. $500 a month in premiums. My husband and I were paying for private insurance for two people, just us. Plus, on top of that, we were paying, like all Americans do, deductibles, co-pays, and all. By the time it was all said and done, we were spending $1,000 a month out of pocket on health care. That's a lot of money. We're like every other family, except that we've had some health issues. This is my husband, Larry, and one of my granddaughters, Bella, and one of my granddaughters, Lauren. And Larry has bad arteries throughout his body. He's got bad coronary arteries, bad arteries in his legs. It hurts him to walk. Tall, thin guy, always been athletic, always spent a lot of time outdoorsy. He has bad genetics. The doctors tell him his father had terrible artery disease, his grandfather had terrible artery disease, and he's had a number of surgeries and problems. This was also one of our issues at the time. We went to South Dakota. I put this in there because it's just fun. 72 inches of snow in 3 days. And Larry couldn't lift anything anymore. Yes, he got to do it. So I just hang out there and benefit. But I also, about the same time, was diagnosed with uterine cancer. The first in my mind was, it's the beginning of the calendar year. We just started the deductibles ticking again. We had a $9,000 maximum out-of-pocket exposure. Don't you know the language of our insurance plans? You have to be a lawyer to even understand. I'm a college graduate and have part of law school, and it's hard for me to understand. And my very first thought was, I hope it's bad enough that I die quick. So that I'm left with a lot of debts, along with a lot of snow. And Larry had his third heart bypass surgery not long after that. I was working full-time, he was not. I show this picture because Larry's arteries are so bad that they've started now they have to harvest them from his arms, arteries from his arms, because he has no viable vessels left in his legs to use in his heart. And as they tell us, if there's ever an issue, the heart always takes precedence for the rest of the body. So he no longer has a pulse like the rest of us do in his arm. And that's what he's supposed to deal with. And then came along this moment that a college friend of mine called me and said, you know, Michael Moore is working on a movie about healthcare. And I said, yeah, whatever. And she called me back a couple of days later just to check in and see how Mary and I were doing. And she said, I really think you should go on the website and check it out. So I did. And then I saw this little tiny thing that said, send us your healthcare horror story. And I typed in this kind of terse, kind of angry message saying, while you're working on this great film about healthcare, why don't you talk about what's happening to middle-class Americans, to people who've always bought insurance, to people who've done what they're supposed to do. Why don't you tell the real story of what's happening in America? And I never expected to hear anything. It was about a month later that we got a call from a producer saying they wanted to talk to us. And this was actually when we first arrived in Miami. It's one of the pictures when we first arrived in Miami. And again, I don't want to spoil the movie for those who haven't seen it, but this was taken on a boat that we were all climbing on and off of incessantly in Miami. And I thought it was funny because even the crew people wanted their pictures done with Michael Moore. So I thought it was kind of funny. It's one of our cameramen and our sound people and producers in the background. They all wanted their pictures taken with Michael. And he's always, I never once saw him, I don't know about Reggie, but I never once saw this man not stop to talk to somebody or not stop. It takes inordinate amounts of time for him to go anywhere because he stops for everything and talks with them and lets his picture be taken and they spill out whatever's hurting them and as you can imagine, he hears stories from what's going on for vets to healthcare to whatever your cause is, Michael hears it. And he does. He's an awesome man. This call was taken at the mountaintops above Guantanamo Bay. While our rescue workers were doing some other things related to Guantanamo Bay, some of us went and toured some of the Cuban countryside, and I love this picture because I just like calling home and saying, you'll never guess where I am. This is in Guantanamo City. This is also Guantanamo City, one of my favorite pictures from the whole trip because there's a church behind those students. And I was naive enough, having been raised as a babe of the 50s and 60s, to believe all the crap that I heard about Cuba and all the, what I thought was godless nation, where Fidel is over everybody. He's got his thumb down on everybody. Not the way it is. These students were out there having a great time singing, and who knows what they were saying about us, because Reggie wasn't with me to translate. So they might have been saying some pretty funny things about those of us from America. This picture also is very special to me, and I will get back to healthcare in just a second, but I want to tie it into my message. I was admiring the flowers on the wall behind me. The young men were trying to tell me in their Spanish that I couldn't understand. Please take one. And I said, no, a flower. And they took the flower and tucked it behind here. Neither one can speak the other's language very well, except the language of generosity and decency. And Michael Moore was not with us for this portion. So. Reggie took this picture with her camera in her hospital room in Cuba. Those are three of our doctors. You might notice two are women. Sorry, Stephen, but two are women. One of the things that's wonderful in Cuba that's very striking about Cuba is there really are half women doctors. And we don't think of the system as looking much different when that's the case. It does. I mean, it's a perceptual thing. You look and you think there's all these wonderful female doctors. And they're also very involved with their patients. They spend a lot of time chatting with you, a lot of time in discourse about your body and about how you're feeling, what you're thinking. One of my most illustrative moments was a pulmonologist had come to see me to talk about my asthma. And I was having one of my 400 cups of cafe con leche, which I liked very much in Cuba. And what happens in the United States when our doctor arrives at the hospital? What happens first? You jump. Everybody jump. Doctor, God's arrived. 30 seconds, you're going to have them. And if you're lucky, you're going to have 30 seconds to a minute. If your family's not there, God forbid, they're not going to hear from them that day. That's not what happens in Cuba. This doctor said to me, no, please finish your coffee, and then I'll visit with you. I was so uneasy finishing that coffee. He was relaxing out at the front desk chatting with people waiting, no big problem. I was the one who was having a trauma with that. Then this is where the transition really began for me in my fight for healthcare for all of us. On Movie Street in Manhattan on May 17th of 2007, Michael Moore brought those of us who had been a major part of the film to New York to pre-screen the movie before they took it to the Cannes Film Festival. Because he felt like we should see it before the world saw it. And we should see what the movie looked like. And just like a little boy, when the screening was over, this big hulking man stood up and looked at the floor and kicked his legs. He's always got that cap on and his shorts on. He said, I hate this part. I can't stand to know what the people who are in the movie think about the film. And I said, oh, Michael, look up. Look up. It's an awesome, awesome movie. That was the day that my dignity and my voice began its rebirth. Because someone cared enough to say, it's not your fault. It's not your fault that you lost everything you worked a lifetime for. My husband has already lost his physical self. For those of you men who are very physical and very active, you know how important that is to a man. To be able to hunt and fish and do the things that he loves to do with his sons and grandsons. He's lost that. And that even though he was as responsible as a human being could be in holding insurance and working and doing all the stuff that you're supposed to do in this nation, he lost his home and he lost his dignity by having his children react in not so compassionate a way and having us move in with them at one point. And I've told Michael several times, I don't know how you thank someone for returning dignity. I don't know how many years my husband has left. I know he's a good man. He and I fight like cats and dogs. We've been married 32 years. We've been around each other. If you saw us, you'd be able to tell that. We bicker. But this man is my life, my soul. So there we were in Manhattan. Broke. No money. Reggie knows this feeling. And yet they're flying us in for these previews of this film. We have no cash. We can't even get from the airport to the hotels where they're keeping us. Right? I mean, this is fun. And here come these wonderful, you see these scrubs that Reggie and I are wearing. Here were these wonderful nurses, that's also my husband standing in the middle, from the California Nurses Association, standing on one side of the street, cheering all of us on. Cheering us on and saying that they want single-payer universal health care as much as we do. Now, the language of our movement can be somewhat frustrating. How many of you have heard the term single-payer? How many of you know it? How many of you don't know what it means? It's okay. You can say you don't. It's all right. A lot of people don't. Single payer can be a very frustrating concept. All it means, we have two single payer systems in this country. They're not open to everybody. We already have Medicare and we have the VA. But they're not open to everybody, as you know. And the veterans know this as well and better than anybody does. We already have a single payer simply means publicly funded, privately delivered health care. Publicly funded, we all pay into one pool, and yes, by God, we pay it through taxes. I'm not going to mince words with you. We pay it in taxation into one pool, and then all the claims to whichever doctors we choose, whichever providers we choose, wherever we want to go, all get paid out of that one pool. And the health insurance companies are finished. The for-profit health insurance companies are not a part of that scenario. That's where the fight for this comes, as you might imagine. I then was able to launch on this strange new life of speaking and activism and speaking for single-payer universal health care because I believe that every person deserves health care when they're sick. And health care to help them keep from getting sick. You know, discussion about preventative medicine in Cuba. What was awesome for me was being able to learn about some things about my body I could do that had nothing to do with traditional medicine. They took me off large amounts of medications and put me on vitamin C to help my allergies. And if I'm real honest with myself, most of 90% of the time, that's all I need. We don't look at it this way in this country. You know, we go into the doctor and a lot of times the first thing we do is prescribe and you're gone. Prescribe and you're gone. So I got to learn some wonderful things about that. This was in Denver. I got to introduce Michael on the Capitol steps in Denver. This is in Los Angeles. My husband wearing his donkey tie for Tom Daschle, which is fine. You know, Tom's not still in office. That was in the Kodak Theater, which is the closest Reggie and I are probably ever going to get to being Academy Award winners. I mean, yes. So Larry and I in Los Angeles, enjoying a few moments. I mean, what a gift for me. I mean, beyond all the activism, beyond all the revolutionary stuff I hope to do with all of you in this world, to give this gift back to my husband. is beyond words for me. In Washington, one of the joys and honors of my life came. I was able to testify in front of the House Judiciary. I am the first and only American, this is tragic too, that has testified in front of Congress about the damage being done to the middle class financially from the healthcare crisis. Now imagine that. This crisis did not sneak up on us. It has been coming for a very long time. And I am still the first American who has testified. And what I told Congress and John Connor's committee is I am so angry with them. So angry with them. They sit on the benefits, and I talked about this earlier, we all provide. We play by the rules. We do what we're supposed to do. My father was a World War II vet who's proudly served his country. He raised me to love my nation, to participate, to vote, to run for office, to raise my kids responsibly, to work, to do all the things, all the stuff that is America. And then they pretend they don't understand that there's a problem. And I told them I'm extremely angry with them. A little bit of a mall, a little bit of Tom Daschle. I always laugh about this picture because poor Larry, my husband, says that if Tom Daschle and I could have pushed him out of the picture, we would have done that. We probably would have. The fun thing about, the good thing about Tom Daschle, the presidential race, I think, is highly overstated in terms of its importance to us, and let me tell you why. Because Congress makes the laws. Congress makes the laws. Yes, I care about who's elected, but not for reasons of health care reform, and I'll go into that a little bit more. Tom Daschle advises Barack Obama on health care. And Barack Obama is not where I need him to be on health care. Certainly not. He's closer than Hillary is, and he's eons beyond John McCain. You can be rest assured I would never vote for John McCain. But Tom Daschle and I have an ongoing dialogue, which makes me very hopeful about what Senator Obama is likely to do. Plus, now Senator Obama is my senator in the state of Illinois. Then we went to Arnold Schwarzenegger's office. This was a lot of fun too. This is just a creepy fun aside about Arnold's office. Just behind those wooden doors, they just barely open. On the wall back there, there's a picture of Arnold Schwarzenegger that looks a little bit like Jesus. You know the funky ones, the halo type of things of Jesus? And I peered in there behind the guy and I thought, okay, that is freaky. Why does Arnold have a picture that looks like Jesus on the wall? But he does. So we were protesting single-payer universal health care in California. This is my husband's revolutionary action. This man is a revenue stream for the medical complex in this country. He has bad arteries and he's insured. He's money. When he walks in the door, you can almost see the clicks. They should like name a wing after him somewhere. And so one of the things that he decided, and this was a brilliant strategy, he can't do some of the things that I'm doing because physically he can't tolerate his peripheral artery disease is advanced enough. He can't tolerate the walking and the climbing and all the things that we've been doing. But he started to ask his doctors, do you support single-payer care? And when they say no, guess what Larry does? Bye-bye. I'm taking my records and my insurance payments. I'm leaving. And he does. So it's kind of a brilliant strategy. I'm very proud of him for doing it. This is I call this his dork picture, where he decides that in 2009 we're going to have single-payer. Now that's a very aggressive thought. I'm not sure we'll do that, but maybe we will. You never know. Here we were at the Lincoln Memorial for the first healthcare justice vigil. This is where I met up with the Iraq veterans against the war for the very first time in person. I had seen a lot of them on TV. But I was lucky enough to spend some time with Jeff and with some of the people in your organization who have been just a blessing to our fight for universal health care. And we held a vigil. We're going to do another one this year on September 26th in Washington, D.C. At the Lincoln Memorial. This is S-chip protest in Denver. I don't know who these kids are, but I love their signs. President Poupier. And then I'm going to close my remarks because I want to hear what other people have to say about single payer and about where they're at with healthcare reform and what they're doing. But I always close with this picture of my beautiful granddaughter, Lauren. I was lucky enough to be with her when she first tickled her toes in the Pacific Ocean. And the look of joy and abandon and freedom on her face, of just the feeling. Remember the first time you felt sand and waves against your feet. as she did. I do not know what will happen for my generation in this fight. I don't even know what will happen for your generation in this fight. I should play with it. I won't leave this to her. I won't. And I need your help to change it. Thank you very much. We may need some help changing the AV. I don't know how much. I think we can explode it.
Flashlights on.
What does that mean?
Safety belt flashlights on.
Oh, your safety belt flashlight. Ooh, my husband would like a safety belt flashlight. That would be good. Dr. Mandel is going to do some interesting and non-traditional things for us so we can think a little bit more about healthcare and how that impacts us.
The song I wrote in high school. I love the headache blues on the possibilities. Got the fun and things I choose. Well, you can sing the chorus with me. It's a lot of fun. Final comes up and we all fall down. Wait before the day we can go on around. So we go together. Epidural, hematoma, nucleus, ambiguous, undescended testicles and pantyhose rash. Dermatitis, appendicitis, coronary arteries, and cold hard cash. I'm treating a patient, mother with Mason's, baby inside her and it's upside down. Time to deliver, hurry and give her plenty of stitches, causing waist and pounds. Put together, epidural, hematoma, nucleus, ambiguous, undescended testicles, and pantyhose rash. Dermatitis, areola, appendicitis, coronary arteries, and cold hard cash. Well, I gotta go now. I mustn't be slow. How can a man expect this squat still stay high? So I forgot the rest of the word. I better restrict my irreverent dicta. Never why epidural hematoma, nucleus, ambiguous, undescended testicles, and pantyhose rash. Gingivitis, dermatitis, ileal, appendicitis, coronary arteries, and cold hard cash. So the first thing is I'm a medical doctor. I'm trained in family practice and holistic medicine. I've been doing an undergraduate yoga practices and teaching to some extent for the last 35 years or so, and I trained other teachers. I'm also board certified in holistic medicine, if I didn't say that. I'd like to just mention to you a bunch of things that may be of use in providing solutions for the ills that Donna has described so aptly. The first is that there is an organization called Physicians for a National Health Plan. And so not all doctors are happy with the current fee-for-service system. And you may like to support or join this group. They do exist, and they have very prominent people like the editors of the New England Journal of Medicine, New England Journal of Medicine, and others. Very well reputed people, and increasingly doctors are wanting single-payer health care. There are difficulties involved with that, in that we're depending on our government, which, frankly, I consider relatively immoral, to govern the rates and manage the whole thing. And so that's a difficulty that many of the doctors who don't want single-payer are afraid of what happens if it gets into the hands of everybody who don't know what they're doing, or know what they're doing and are evil. The second thing is that we do actually have a third single-payer health system called Medicaid. And so expansion of Medicare and expansion of Medicaid is the easiest conceptual way to get this kind of thing for covering everybody. Understand that Medicare, people do pay into it a certain amount, like $98 a month, depending on the plan, but it does provide a large variety of services. It's been found in Canada that co-pays do not cut down on the number of patient visits. So we just have this system by which, for no reason, people have co-pays. One thing you need to know when discussing single payer or similar health systems, I got somebody on me. Is it that boring? So for care to be free, then I would have to make a living begging. And that's we'll get into that a little bit. So the issue is that there's a lot of work that goes into medicine. It's very, very intense, at least from my perspective. It's a very intense kind of thing, and filled with angst, and filled with a lot of difficulty, and staying up nights. It's really pretty tough. And so for somebody to go through 4 years of college, 4 years of medical school, another 3, 4, or 5 years of graduate school or graduate training at a very, very low rate, basically when people make a Taco Bell, they make a little bit more than that, then they have to make something in advance. Another model for medical care, which is useful for the uninsured, is what we're doing right now in Johnson County, and it's well developed in Asheville, North Carolina, Mecklenburg County, has what's called Project Access, so they have different names for it. And by that, we figured that the average medical doctor, we figure that right now approximately 85% of the U.S. is insured in some way, either Medicaid, Medicare, or private insurance, and then about 10-15% are uninsured. So in a situation like that, you can actually generate a system by which the doctors, nurses, hospitals, they agree in advance to take people on for free. And the person gets an insurance card that says Project Access. You see them, it's free. It doesn't cost anything for that individual, and you work out with pharmacies and everybody else. It takes organization, but it's much cheaper than repeated ER visits. Having said that, ER visits tend to be so much more expensive because there's a lot of cost shifting involved with people who come and simply don't pay. The next thing you need to know is that approximately 30% of our healthcare dollar does not go to healthcare. It goes to insurance companies and the executives and the people who have shares in those insurance companies. And so to eliminate that, the single-payer system is relatively marvelous because Medicare and Medicaid only have about a 5% overhead. And so with the money that you would save in this administrative overhead, you could pay for everybody's insurance costs and there's no problem. You follow what I'm saying? You just take it off the top. The people who are skimming the cream, you put the cream back in the system, and then everybody gets taken care of. The next thing you need to know is approximately at least 50% of the bankruptcies that occur in the United States are because of health care. That is, we have situations like Donald's and other people who have some catastrophic illness and they can't pay for it, they can't go back to work, and so they simply go down the tubes and they wind up either homeless or they wind up with in some kind of disastrous situation. And so this is part of what's driving our subprime mortgage, and this is part of what's driving our economic disparities. So, I thought I would mention a little bit about what Prout has to say. Prout is an ideological principle that was created by P.R. Sarkar, who was an Indian philosopher, guru, all-around Renaissance man who wrote 5,018 songs and speaks I don't know how many languages. Unfortunately, he's passed off the planet in about 1990 or so, and he created an organization called the Vande Marga, for which I serve as the president of the Vande Marga Universal Relief Team. We go to different countries and also disaster sites here in the United States, providing health care and education and free care for a lot of different people. And I've been to Haiti and Venezuela and Nicaragua and Jamaica and a bunch of other places, and Katrina and places like that. So the Prout approach to health care is various. It's kind of complete. He doesn't have a lot of kind words to say about the financial thing. There are a variety of different what they call pathies. Homeopathy, which uses subtle amounts of microscopically small dilutions of medicines to cure people, and it's like magic. Nobody understands how it works. It just triggers the vibration. Naturopathy, which uses vitamins, herbs, hydrotherapy, and diet. and that also works very well. And there are double-blind controlled trials for all of these things. It's just that the current medical establishment doesn't buy into it by and large. Then you get things like acupuncture, which is now becoming fairly well accepted, and allopathy, which uses surgery and hard drugs of one kind or another to cut down on the symptoms the patient has. And pain control is a huge issue in this country, with people being addicted, but also people being 50% of the population has chronic pain after the age of 35 or 40. So it becomes hell on wheels for me to try and figure out who needs what, who's abusing it, how much the pain medicines are giving the problem. So that's part of the deal. Prout does not specifically advocate any particular payer system other than healthcare is a minimum basic necessity which any proper society, any government worth the name is going to provide for all people. But as a right, it's called a right. To me, a right is something that you have like for free. But medical care is this huge endeavor requiring the cooperation of many, 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 many people to bring healthcare to the point of services to one person. So, he says, for example, that when the patient dies, he shouldn't accept money for that visit. But on the other hand, if you're seeing the doctor, and you have the money, of course, then you should pay him for that visit. So there's, this certain amount of give and take that goes into it. Next thing I'll mention is that part of the reason things are expensive is, at least on the doctor end, is that we have fewer doctors than we could probably utilize. The AMA has mandated that we limit the number of people who actually get into medical school. And so many people more would go into medical school. But because of the shortage, we have fewer doctors in various places. So eliminating that restriction would be helpful. The advent of physician assistants and nurse practitioners has improved that situation somewhat, and made it cheaper. And so I'm going to say that's all I have to say about that. Thank you.
Don't forget, if you want a sickle, let me know. I'll get you one. Okay? I also want to mention that the reason I talk about the presidential campaign not being the sexiest race or necessarily the most important, I'm going to leave another DVD here for those who'd like to learn about it. There already is single-payer healthcare legislation in the U.S. Congress. It's already there. It's called H.R. 676. It already has 90 co-sponsors on it. 90 of our Congress people already support single-payer universal health care. I know, it's confusing, isn't it? 90 of them are already signed on to John Conyers' bill. You can go to a number of websites and check out the names. Thomas.gov gives you the current names of all the co-sponsors. I'm going to leave these two up here. Please feel free to take them, and also you can let me know if other people would like them. This is about a 22-minute video that was prepared about H.R. 676. I know that in a utopian world, we would all get health care. We all just did it because we all deserve it, because it's a basic right, but we've got to take some steps to get there. And so that's why I fight for H.R. 676. Its basic mechanism is, and PNHP is one of the organizations that supports it, 14,000 members strong PNHP is, and 59% of our doctors surveyed already do support a national health care system. So the support is out there. But the way this would work was we would all pay an additional 3.3% in payroll tax. Every one of us would pay it, everybody. Everybody in, nobody out, 3.3%. But you would never again pay a health insurance premium. You would never again pay a copay. You would never again pay a deductible. So if all of us would do the math behind that, I think you'd find out like we did, you come out a lot ahead of what we're doing. And I always share with people, because you hear this trauma about what would happen in the U.S. economy. Oh my God, there'd be so many people thrown out of work in the insurance companies. I mean, this industry is big money. We're talking about almost 18% now of the gross domestic product. All of our economic activity in this country, about 18% of it goes to health care. That's a huge financial engine. So people are afraid to tinker with it. There are very powerful forces that don't want to tinker with. But imagine for a moment with me, A world where we each pay 3.3% extra out of our payroll. And the rest of the money we've been spending on health care can be spent out in the American economy on other things. Maybe, God forbid, Donna and Larry could get a car newer than a 96 Corsica at some point in history. You know, the cars you see us in Sicko, so we only have one of them, so the two now, but, you know, we could invest, American families could finally start doing things and invigorate this economy in ways that we have not seen, in ways that we do not envision. So I see this as an extremely revolutionary thing to do, and believe me, the insurance companies and the pharmaceutical companies see it as revolutionary. They're fighting. They are fighting. And we need to get 100 co-sponsors in order for it to rise to the level of debate on the floor of Congress. So those of us who are in this fight, that's our fight right now, is to make sure we get 100 co-sponsors. So I'm going to leave these up here too. So there's one copy of Sicko. I'll let you battle each other for that. And then there's these little, you really don't battle each other. We're at a conference where we're not supposed to do that. And there are little pieces of paper. If you want a Sicko, a DVD on HR 676 or both, just fill one of these out and leave it here for me, and I will mail it to you. So that's my pitch for the political angle of this little paper at the moment. Our next speaker is going to be Geraldine, and I've got a cheat sheet with Geraldine a little bit. It says here she's a librarian and researcher. Cool. I like librarians. Turned natural health and small farm advocate fun. And she's the author of The Two Faces of Money. So please welcome Geraldine.
Okay, obviously most people in America would agree that in a sane world with an honorable and ethical government, we the people would at the very, very least have access to at least the same kinds of health care that our government officials have seen fit to bestow upon themselves. But the truth is that even this may not be enough, and it's kind of been alluded to already, because embedded within even this most generous healthcare program, government program, there are some what I call fatal flaws. One of these flaws has to do with the solemn and inalienable right to personally choose healthcare treatments, including natural remedies. This thing is just, this whole idea is usually just disregarded. It's not thought of at all in our medical system, or we call it health care. It's really sickness care. Another flaw has to do with the nature of bureaucracy. I touched upon already. This bureaucracy includes massive amounts of usually redundant paperwork, and also any number of gatekeepers that are positioned at various junctures along the way. Both of these things, intentionally or otherwise, really serve as roadblocks to timely and effective healthcare delivery at the personal level. The last thing I want to just touch on is, it has to do with how to pay for all this, especially in these really increasingly hard economic times. Let me start by saying that I was an ardent supporter of Dennis Kucinich. Ardent is probably not a strong enough word. Of Dennis Kucinich's original health care bill. And what this did was calculate the savings that could be realized. That he used to say, health care for people, not for profit. But one of the most important reasons that I personally was so much in favor of that bill was that it actually included freedom of choice of provider and freedom of choice of treatment, including natural remedies and supplements. It was, therefore, to my never-ending frustration that everyone I talked with or listened to missed that important point entirely. This was really odd to me because it's really through this measure that not only could we achieve far better and actually truer health care in terms of our current system of sickness care, but we could do it for far less cost. The simple fact is that natural remedies are far less expensive, they are often more effective, sometimes far more effective, and of course far less high-tech than their more conventional, invasive, and petrochemical-based counterparts from the mainstream medical model. The bottom line is, though, that you can't talk about healthcare without also talking about money. So I've collected together some points that I think we all, from this point forward, need to think about seriously and hard. To start out with, in 1940, a 10-day stay in the hospital cost $41.50. But with the creation of the Medicaid Medicare program, that federal money spigot was actually opened wide to corporate welfare. And this then led to an explosion in healthcare costs, along with a variety of mostly useless, high-tech medical innovations. And this is if any of the mainstream assessment tools are to be believed. This program, Medicare Medicaid program, also created, it has to be said, limitless opportunities for fraud. So over the years, and as is its penchant, the government then put in a system of complex controls and also created a structure that does not always really reflect the true and actual cost of the health treatment being provided. The government has also managed to exclude so many treatments from this program that in reality, the program itself has become little more than a Band-Aid, even for those who are covered. At the same time, governments allowed the insurance companies and the medical industry to basically write the rules, which are, of course, always oriented to those industries' own bottom lines. So today, a significant portion of the monies that are allocated to the healthcare programs go to the support of administrative paperwork that's required at least three levels. That of the healthcare provider, that required by the insurance company itself, and that required by the government. Each level, of course, of this layer of paperwork reduces the amount of money that can be spent for actual delivery of services, and yes, it even gets in the way of the service delivery. Of course, the taxpayer pays for all of it, including, it has to be said, the waste, fraud, and abuse that are embedded in the system. The problem, an additional problem that we face today is that there are many more retired baby boomers than wage earners to foot the bill, pay the tab. And we're all alike in this rising, exploding costs in terms of food, energy, not to mention medical costs. Dennis's original plan called for taking, as we talked about, taking the insurance industry out of the equation and folding the employees of that system into the government system, and thereby achieving savings of some 30% in overhead. So this was a really good start. And together with the savings that could be achieved through the far lower costs and more health-enhancing properties of natural remedies and diet, the combined savings together would probably be sufficient enough to cover, with a decent standard of care, the 40 or 50 million uninsured. But there's still a problem, because even if we, by some miracle, turn off the money spigot for our various military adventures, we still are left with a whole host of competing interests and needs to deal with. And there's the problem, it has to be said, and as our forefathers knew, big government is a big problem. I think there is a solution, and that is to create what I call constitutional, democratic, debt-free money. This could actually and potentially put the government out of the entitlement business altogether by providing a debt-free medium of exchange with which citizens would be able to provide and pay for health treatments themselves either through authorization, that's citizen authorization, of an appropriately designed federal system of health care, or through health care savings accounts or some variation thereof. But whatever type of program is eventually adopted, I believe that it would be to our enormous advantage and benefit that we at the same time make sure that the program falls within the original constraints of the founding documents, the Declaration of Independence, the Constitution, and the Bill of Rights. Forget this Amendment 16 After, just those three. Also, by its very nature, this would mean an avoidance of a top-down managed system, which all too often puts sovereign citizens at the bottom of the totem pole. And also, along with this, and insofar as possible, we need to keep the government out of the business of granting rights, because rights granted by the government can be rights taken away by the government. So in summary, and by recognizing and embracing the principles and the wisdom of those three founding documents, we might finally, at long last, be able to behold, in the borrowing the words of William Jennings Bryan in his imperialism speech, we might be able at long last to behold a republic applying in practice and proclaiming to the world the self-evident propositions that all men are created equal, that they are endowed with inalienable rights, that governments are instituted among men to secure those rights, and that governments derive their just powers from the consent of the government and not the other way around. Thank you.
Thank you very much, Geraldine. I'm sure she knows, too, that Dennis Kucinich is one of the chief co-sponsors of HR 676. So that's a great thing, too. Next up in our panel is a young man I just met yesterday. But he has a wonderful spirit, I'll tell you that much, just in the few interactions we've had. Eric is from New York, and he's a writer, which is a person after my own heart. He blogs and does a lot of journals, and you don't get paid an awful lot for that usually. There are a few of us who get a little bit of money for doing that. My favorite blog I've written is on Huffington Post. It's called Bush Got a Better Colonoscopy Than I Did. And one of my favorite comments that came after the blog was somebody wrote on there, that's because he's a bigger asshole than you are. Pardon my language. So I want to introduce you, Eric. He writes for The Nation. He also has a great perspective as a patient who's struggling with the system, and I'll let him share that with you.